Good morning. It's April 12th, 2026. And I would just like to say what a wonderful morning it is. And today, my name is Owen McCafferty. It is tomorrow too. Uh, I am brought to you through the kindness of Professional Fusion. Um, we're introducing a four-part series, not including this one, but a four-part series on a very important topic area that I would like you all to consider. And the title of this is Back to the Future uh, in Professional Practices. Back to the Future in Professional Practices is a recognition that there are availabilities, opportunities that exist in practice that you don't have to be stuck. And you can use the historical perspective, as I have, and create what I consider to be an opportunity that takes into consideration a plethora of different variations on the theme. So we've created this four-part series, and we'll have guest speakers come in and provide some ideas and thoughts. Now, these aren't going to be long. We don't want to have long, drawn-out narrative, but what we want to have is useful, practical information that you can take back and consider. There are many opportunities that exist for you in practice. They are not limited. As you might have heard, some of you may have been through the historical perspective, as I have, over the last 48 years of practice within veterinary medicine and 51 years of practice as an accountant. I've seen an awful lot. I'm a certified veterinary practice manager, and I did it the honest way. I passed the exam. In fact, when I took it, there was even an oral. In fact, I designed the oral, so I couldn't take it right away. I had to wait until there was a circling out of questions before I could actually participate myself. This was all brought to you through the Veterinary Hospital Managers Association here in the United States, and then in Great Britain, a group that Mr. John Sheridan, a British veterinary surgeon, and I formed, known as the Veterinary Practice Management Association. I think since then they may have changed their name again, but it was the Veterinary Practice Management Association of Great Britain. And since I was the only one with a lifetime membership from the Republic of Ireland, I also wanted to throw in the Republic of Ireland, so I did. So there's a little history of how things had evolved. And veterinary medicine had a business segment. Gosh, I can remember what I considered the true grandfather of veterinary practice management. That was Dr. Jack Judy. Some of you may have remembered him in Michigan. Was a wonderful man, very insightful, very thoughtful. Of course, there's Bob Lewis. I know once I start, I'm going to forget a cool billion people. My good friend who's recently passed from us, I'm sure to a much better life, Mr. Mark Opperman, who not only formed the Veterinary Practice Managers Association, also founded the Certified Veterinary Practice Managers Association, and was the catalyst in the initiative and the inspiration, if you will, for John Sheridan and myself starting the Veterinary Practice Management Association of Great Britain and the Republic of Ireland. So some of you are members, and you may remember what it was like in the old days. So I'd like to bring back some of what was, some of what is, and some of what will be. That's why I chose the title of Back to the Future. Obviously stealing it from a very wildly successful series and franchise on a play of words. But what I want to do within the scope of the four series is to provide some input of what exactly did happen and why it happened. We want to do things like not only look at the nostalgia of what was, and there's nothing wrong in looking at nostalgia, but also maybe looking at authority from the standpoint that we know things have worked in the past, what worked in the past, what didn't, what's starting out on the new front. And I'm directing this towards the practicing doctor of veterinary medicine and the certified veterinary practice manager, be you in the United States or the same program in Great Britain, the Republic of Ireland, or in Canada as part of the Veterinary Hospital Managers Association. And maybe some folks in Australia, New Zealand, South Africa, in the North countries of Norway, Sweden, Denmark. I know we had some members up there, at least what last time I checked, with the Veterinary Practice Management Association. So we want to go back to the future on some of these things. And I'm chewing up a little bit of time just to give you a basis for what we were thinking, why we thought, and what we did. Oh, and great minds that brought things to the forefront in veterinary practice management. I can't forget my good buddy, old Tom Catanzaro. Dr. Catanzaro distinguished himself for having a master's in hospital administration. He served in the military. He was a guiding force in the American Animal Hospital Association in their establishment of veterinary practice management, along with another good buddy, Bob Freilich. Gosh, we could go down memory lane and just list everybody. But in fact, that's probably going to be good for a future video. But what we want to do is talk about rebuilding professional ownership. Now, obviously, veterinary medicine is our focus for today, but this follows directly in terms of dentistry and dermatology. Things have changed, and part of the reasons things have changed is the monetization in the sale of practice interest that is not based on intrinsic worth, but rather investment value or even strategic value. Saying it a little more succinctly, practices are generating an awful lot of money in the sale of the practice, but as you'll see in this 4-part series coming up, that may not necessarily be prudent or logical or in the best interests of the doctors. Everything has its own time. So remember, we're going back to the future. We're going to remember what was occurring, and then we're going to look to the future and see how that can evolve for you. Age has an awful lot to do with it. Attitude is a phenomenal thing. Excitement of what it means to be in a profession. There is a factor that we want to think about in the course of these 4 series on Back to the Future, and that is the word profession. Profession implies and is unstated but clearly noted that it is a body of knowledge coupled and governed by a written code of ethics, sanctioned and recognized by a governmental entity. So those 3 things: body of knowledge, code of ethics, and sanctioned by a governmental entity. Well, the body of knowledge, be it veterinary medicine, law, architecture, accounting, engineering, registered nursing, actuarial science, all of the medically based professions. We mentioned registered nursing. That is part of that medical based profession with physicians, veterinarians, dermatologists, podiatrists, ophthalmologists, orthopedic surgeons. We could go on forever just listing them all. But those people that with a body of knowledge that is truly, truly tested by a governmental entity, and sometimes it's tested in a series of situations. Sometimes there's recertification that's even required. I wouldn't want to take the CPA exam again, I'll tell you that. But these are the things that make that body of knowledge. The body of knowledge is continually changing. It's vibrant. It's operational. which means you must have continuing professional education. Some of the professions call it continuing education, some of them call it continuing professional education. But once you secure that body of knowledge, that's only the start. You've got to then keep it fresh. And that's where things like certifications in sub areas of interest. For example, I'm a certified veterinary practice manager, but also I am a fellow of the American College of Forensic Examiners. I'm certified in financial forensics. I'm a certified global management accountant. And I have a focus and an interest as a candidate for the American Society of Appraisers. So I focus in on those things, and it takes a long time. Sometimes, gosh, I've had years where I've had over 210 hours of either video or in situ, that means in person, in the situation of continuing education, not even counting the hundreds of hours that I give, sometimes yearly, for continuing education, either on the web or in person. So just to give you an idea about what a profession is, the first one is that body of knowledge that has to be currently maintained. Second one, code of ethics. Now, ethics is an activity. It's a philosophy, I grant you. It's part of that segment that requires a person to conduct themselves in a certain way. Now, you notice the word require. There are other forms of ethical standards. There's a personal ethic, for example. There is a company ethic. But in a profession, there is a standard, let's call it the least common denominator. It's the least ethical standard that you have to follow, and it's written. It's written so that you can be clearly assessed if you violated it, and you could lose that precious license. So that's the second segment, a code of ethics. It's an ethical activity. It's part of the study of philosophy, but it's the least common denominator. Your personal ethic could be much greater. The company ethic could be much greater, but the written code of ethics in a profession is clear. The third one, and probably one of the most distinguishing items, is that your state, commonwealth, province, entity, whatever political subdivision you're in, actually recognizes your activity as being in a profession. Now, you could be in an occupation, an honored occupation that has a body of knowledge and a code of ethics promulgated. But if the state does not recognize it as being in a profession, then theoretically you're not in the profession. You conduct yourself in a professional manner. Now, the reason why I want to go through this and give this narrative as the start of our introduction of Back to the Future in professional activities is to set the tone. I'm only talking about those that have a body of knowledge, code of ethics, and are sanctioned, that is recognized through state, commonwealth, province, or other political subdivision as truly being in a profession. So that gives you some idea about the focus. Let's look at some of the things that occur, and we will, that really did work wonderfully in the olden days. Now, the first time I was exposed to veterinary medicine was 1976. Ironically, that was the same year that I was granted a license to practice as a CPA. In those days, you had to have 2 years of experience prior to the time that you could be licensed. And you had to pass what I call a hellish exam. Of course, like everyone who's taken an exam, it's so much easier now. But when I took it, it was really, really tough. And that's not really true. And my son, who's my partner, and has been involved in veterinary medicine since he was 7 years old, he's now 45, would tell you the same thing. So what we're going into is to try to really evolve into that which was, assess if that which was, that which could be, and then make the determination that which will. So past, present perfect, and future. So let's go through and look at not only the conditional, but let's also look at what it would be involved in the process. And I'll go through a very quick overview. There, when you graduate from a school, a professional school, you pass an examination of licensure. If it requires, such as in architecture or accounting, that there would be practical experience working for a qualified and recognized firm that you can then gain licensure. And of course, there's always the re-examinations that some of the professions have. You're ready to present yourself to the public in your professional activity. That professional activity, though, has a lot of demands that are placed on it. So that you have to ask yourself, what kind of knowledge do I have? If I'm really, really good and I've had a lot of experience and let's say 5 years of experience, 6 years of experience, I might think that I really do know a lot, because when you graduate from a professional school and then you take an examination of licensure and you pass it, anyone in a profession realizes that's only the start. That's when the education really begins. So maybe after being in a profession for 5 or 6 years practicing, you might feel ready to go out and look at acquiring a practice or joining a larger practice. And a lot of that depends on your interests too. We'll be exploring some of those ideas and thoughts about when you want to be in a practice, when you want to work. Is it for you that you really want to own a practice, or would you rather be a very prestigious associate in a phenomenal practice? Do you want to take your future and invest it in an entity that is so large that it could even be publicly traded or vastly recognized as being a leviathan of a practice group? Do you want to go into specialization? Do you want to focus in on a hospital, a large hospital setting? So there's so many different options that are available. In this 4-part series, we'll go through that. We'll explore the person and how that person has to make an assessment as to what really they want to do. We'll be talking about the mythology that exists too, the difference between being in a profession and being in an occupation. And then we'll talk about the current flavor du jour, and that is quality of life. Of course, not everyone would agree with me, but my own personal prejudice is that when you're in a profession, there is no quality of life, because you're there to serve. In some professions, it's a client. Some professions, it's a patient. Some professions, it's a client and a patient, such as what happens with veterinary medicine. And that brings with it a whole slew of ethical complications and nuances that should be explored. But the first 4-part series of Back to the Future in a profession will focus more on the assessments, and we won't necessarily get into all the details, but we're going to try to get as many as we can. So this is an exciting time. It's something that I find to be very, very important. Being in a profession myself, serving dentistry and veterinary medicine and dermatology and human pediatrics and a whole slew of others over the last 48 years, gosh, even 51, where I first started, I worked for practices, medical practices. So we'll be doing all of that. And the other factor is I sure would enjoy, I would appreciate, I would be most grateful for any comments that you have. Comments that are constructive, either yay or nay. Maybe you don't agree with everything that's been said either by myself or possibly some of our guests that are being brought into this. We may decide at the conclusion and the commentary to expand Back to the Future beyond the first 4 segments. But we want to start from somewhere. We want to give you a good foundation. And we have a platform. Professional Fusion is graciously allowing me to present this series. So I'm really grateful that you're tuning in. Gives you an idea where we're going. We're going to have experienced people. It's not going to be theory. They're going to be looking back to the past and springing to the future. So we'll do a little futurology. We'll do a little history. We'll prognosticate, which could be. There's so many different complications. And sure, we may be specific in one profession or another. For example, in dermatology, Dr. D. Allen Tack, Jr., who is not only a boarded dermatologist, but also a Mohs surgeon, is going to bring us views that relate to dermatology and options that are existing. In dentistry, I'm very excited. My good friend, my long-term friend, Dr. Mark T. Bentley, who's seen it all. And no, he hasn't been in a cushy West or East Coast practice, but in the solid Midwest. He's going to talk about building up a practice and some of the options that are available and his perceptions. My good friend, Dr. Jamie K. Pickett and Dr. David A. Tack, who's a doctor of veterinary medicine. He's the father of Alan. And of course, my own son, Hugh, bringing in the issues of what's occurring in accounting and where we think accounting may be going. And then the inner relationship, the fusion, if you will, of the disciplines of all the professions and every other aspect that occurs. And what we may do is bring in other guests and other professions. Depends on what your approach is and what you think is occurring. So it's an exciting time. I'm just using these few moments to introduce this. And Dr. Jamie Pickett and I will be talking in our first segment on the 4-part series of what's occurring back in the future. So it's an exciting time. Sure hope that you will not only participate by viewing or listening, but then maybe writing comments that we can learn from. Let's make this truly an interactive opportunity. So with that in mind, this is Owen McCafferty speaking from beautiful Ponte Vedra, Florida. And it's, yes, a Sunday, and it's also real close to a deadline. So you know what I'm doing. And I hope you're doing great things too. So with that in mind, I would just like to say thank you very much and stay tuned for the series.